Parents, I believe, care more about their children than the medical profession.
The FDA is telling someone battling a disease like cancer that they cannot have a potential life-saving treatment.
You don't take somebody off of a treatment that's working and doing well. I think that's just injustice.
At the heart of it all, the freedom to choose whatever treatment a patient wanted.
The FDA has transformed itself from regulator to persecutor in this case.
Every parent knows what it's like to have a child with the flu. It usually goes away after a few days. But not for 2-year-old Dustin Canary. His severe headaches and other flu-like symptoms kept coming back, leaving his parents and doctors baffled. When Dustin got even worse, an MRI revealed a cancerous, golf ball-sized brain tumor. His doctors prescribed an aggressive radiation treatment that carried the risk of devastating effects. Dustin's parents, however, refused to accept such a possibility.
At one point, one of the oncologists told my wife, she said, "We'll get that tumor, but you have to expect that Dustin may be in a wheelchair."
His time left on Earth would have been short, but it would not have been the Dustin that we knew.
Stunted growth, sterility, low IQ. This is our cure. This is what we're going to give you. Your son back in a wheelchair with all these issues that he's got to deal with till he dies. In my mind, I knew I'm not going with this treatment.
There was a nurse, and she told me, "Don't give up." She said, "There is a world of treatments out there. Do your research." As long as Dustin lived, he would have a quality of life. That's all we were basically looking for.
When he came to us, he was quote-unquote incurable.
Dustin was born in May of 1991. He was your typical healthy, happy little boy who loved being outdoors.
I always felt he was a little more laid back.
He seemed to get along easily with people.
He was a why child. Why this, Mom? Why that? He was a very happy little boy. Dustin was a very healthy child. Was never sick. The only thing I brought him to the doctor for was your regular checkups.
When Dustin was 2.5 years old, his family noticed some changes in his overall health and behavior.
On Christmas of 1993, Dustin became very ill with the flu. The other kids had the flu, but it wasn't the same.
Dusty was very energetic, and the first indication that caught my attention was one day he was playing, and all of a sudden he just started to scream.
I noticed also that loud noises would really bother him.
He could be in a room that was full of children playing, and he would lay down and go to sleep, almost like his body was shutting down.
He'd want to be with the other kids playing with them, but just couldn't keep up.
Dustin became more ill.
A lot of vomiting, and he was just a sickly little boy for a couple months there.
But then he was having trouble walking.
As he's walking, we noticed that he's kind of stumbling, I believe, to his right side, and he actually reached out to support himself on the wall.
In my heart, I knew that something was extremely wrong.
All the medications Jack and Marianne tried were having no effect on Dustin's increasingly severe symptoms and general listlessness. The Canaries urged their doctor to give Dustin a more thorough examination.
They did blood tests, and they checked him, and even drew blood and did extensive testing. They said, well, maybe he has like a little infection. So they sent us home with antibiotics. They said if he doesn't get better in a short time, bring him back. Well, every other day, he started to have flu symptoms, and he did have severe headaches. I mean, severe headaches, where Tylenol, ibuprofen, nothing would stop the headache.
We knew that there's more going on than a stomach flu or something. I had to go to the doctor myself. Dustin didn't have an appointment, but I brought him to the doctor with me. The doctor looked me over quick and said, Jack, you're okay, but he said, we've got to get an MRI scan for Dustin. There's something we need to check here.
Jack called me and said the doctor thought there was something severely wrong with Dustin.
As I sat there by Dustin's scan in the room with him, it was real apparent to me that my son had a brain tumor.
Two-year-old Dustin Canary had been experiencing chronic flu-like symptoms. An MRI revealed that something was indeed seriously wrong with young Dustin. He had a brain tumor.
He took the scan and he said, Jack, this is the tumor. He showed me where it was, showed me the damage it was doing, and said, we've got to deal with this. We've got to get at this tumor right away.
It was located between his cerebellum and his brainstem in the back of his head. They ordered a surgery.
The neurosurgeon felt pretty confident in what he was doing.
And he just reassured us that he would get out as much of the tumor as he could.
Risks in operation involved potential loss of motor skills. It's an area of the brain, I believe, that it can affect your breathing. Those are the things you don't know until after surgery is complete.
I was relieved to know what was wrong, yet to have to put my 2.5-year-old through a surgery that we didn't know the results. That was very, very hard.
Following surgery, Dustin's neurosurgeon confirmed he had been able to remove most of the tumor.
He told us that he was able to remove about 75% of the tumor. There was some that was left along the cerebellum and along the brainstem.
And he said, I do have some troubling news for you. The name of the tumor was a medulloblastoma, and it is a very aggressive stage 5 brain tumor. Ultimately, Dustin didn't have very long to live.
We were told by an oncologist that he may have as little as 6 months.
Because of the aggressive nature of Dustin's cancer, his doctors recommended that immediate action be taken to halt its growth.
Typical treatment for brain tumors is radiation.
The next day, the radiation therapist came in and gave us pretty much a death sentence for Dustin.
Being Dustin was under the age of 3, he told us flat out, if we radiate Dustin's brain, he will be a vegetable. No question about it. So we eliminated that option. We're not going to do radiation.
The Canaries had another choice, chemotherapy.
We're trying to be open-minded. I had my concerns already about chemotherapy, but we had to check it out. We had to see what the options were. We were consulted by our family doctor, and he says, there's an experimental treatment that they're doing at the University of Minnesota involving different regimens of chemotherapy drugs.
The computer would pick the drugs that Dustin would be on. And the drugs were horrible. I talked to my brother, the doctor. I called him up and told him what the drugs were, and he said, they use that on children? We started researching on our own and finding out that chemotherapy really didn't work very well on brain tumors.
Side effects were devastating. We've got the consent form that we never signed that lists the effects of the chemo drugs.
In the form that they gave us, it did say that these drugs could cause possible death.
We told them we needed some time to think.
When they weren't able to persuade Jack, he said, if the Lord had given me a handicapped child, I would have accepted him, but I am not going to make him to be handicapped.
When we heard the percentages and the side effects and the whole scene, I thought, I can't do that to my son. So we looked into other alternative treatments.
The Canaries embarked on a quest in defiance of conventional medical wisdom.
Even if it wasn't that long, quality of life was what we were looking for. Jack's sister gave us information that she heard when she was looking for an alternative for her rheumatoid arthritis. And that's where we found Dr. Brzezinski. We contacted the Brzezinski clinic and asked them if Dustin could go on the treatment, being that he was under the age of 3. Dr. Brzezinski did need Dustin's records.
We went in just to get our medical records, and there was a couple social workers, head of the oncology department, at least 6 different people. Said, we want to talk to you. I said, I don't want to talk. I just want my records. I want to go. They brought us in a room, closed the door, and explained to us that doctors take precedence over parents. You have an obligation, or we'll take, and we will treat Dustin with the chemotherapy against our wish.
Marianne Canary's 2-year-old son, Dustin, had a highly aggressive, cancerous brain tumor. Because Dustin was so young, treatment options were extremely limited, largely untested, and offered grim prospects. The Canarys heard about Dr. Brzezinski, a pioneer in cancer research and treatment. But their doctors warned Jack and Marianne that Brzezinski's methods were dangerous, experimental, and not FDA approved. They even threatened to force the radiation and chemotherapy treatments on Dustin without parental consent.
I told them, I'm not going with the treatment. I said, you feel you need to pursue this? I need to pursue what's best for my family.
We told them we're looking into alternative treatments. We mentioned Dr. Brzezinski. She told us that, well, I think you better reconsider, seriously reconsider even thinking about going to him, because he puts people in the emergency rooms, and she heard a lot of bad things and that he was just out for people's money. We said, well, you know, we're going to research it and we're going to do the best that we can for our son.
We grabbed our medical records, we walked out.
The Canary family loaded their car and embarked on the long journey from Minnesota to Houston. They weren't sure what to expect, but they were at peace about their decision. Finally, they met Dr. Brzezinski and his team.
It was about 5 weeks after his surgery. So recovered from surgery. When we had a scan, we were able to see residual tumor.
Once we were at the clinic, consulting with Dr. Brzezinski, there was a real calm, a real assurance. I was confident. I just appreciated Dr. Brzezinski's honesty, his optimism.
He told us that Dustin had an 80% chance that he would initially respond to the treatment.
Dr. Brzezinski's treatment involved the use of anti-neoplastons, a protocol he developed during his early years of research.
Dr. Brzezinski came up with the name anti-neoplastons, which means against new growth.
It programs the cancer cells to mature and die like regular cells. So you're getting rid of the cancer cells and producing cells that are normal.
He was admitted for the treatment with intravenous anti-neoplastons. We trained the family members, the parents, how to self-administer the treatment.
And Dustin had to go on IV, and it was a little portable pump that we put in a backpack and 2 bags of anti-neoplastin therapy.
It was hard for me to see Dustin carrying around that. I thought it was a big, heavy backpack for a little guy. But it seemed like it just got to be something that belonged to him.
As Dustin was on the anti-neoplastin therapy, his energy became greater. He started running around more. He was just as normal as any other 3-year-old. There was no side effects. Dustin would live a perfectly normal life.
And after 6 weeks, when we repeated MRI of the brain, we found that the tumor was gone.
I remember coming home with that scan, and I put the post-op scan. I took the 6 weeks of Dr. Brzezinski's treatment, and I stuck them both on the window. And I said, Marianne, come here, you got to see this. I said, look it. Here's where the tumor is, and you could see it on the scan. It would just glow. I said, here's the scan that he just had. I said, there's no tumor there. There's nothing there. It's like we won.
Dr. Brzezinski put Dustin on a low dose of anti-neoplastons as a maintenance treatment to ensure Dustin's cancer wouldn't relapse.
We were doing scans, I believe, about every 2 months, every 2 to 3 months, we were doing an MRI scan just to make sure there was no reoccurrence.
It was exactly 1 year from starting the treatment. We had an MRI. It was in April 1995, and we got a phone call from St. Luke's Hospital.
And she says, the MRI scan came back, Dustin has a second tumor.
We thought, here he's running around, he's normal, he's living a full life, you know, learning to do whatever a 3-year-old does, and it was really a hard blow for Jack and I.
Jack and Marianne heard from Dr. Brzezinski that it would be taken care of, but that it might take a little longer.
I said, I'm sorry. I said, I'm learning as I treat. A year ago, we diagnosed a tumor and we gave him a treatment. But as his weight increased, we should have been increasing the dosage.
We came up with the new version of the medication, which was more concentrated. And we decided to give him more intense regimen, higher dosage of the medication.
He says, don't worry about it. He says, well, this tumor will respond as well.
But Dr. Brzezinski came under attack from the Food and Drug Administration and the mainstream medical establishment. The FDA filed multiple lawsuits in an effort to shut Dr. Brzezinski's practice down.
During my medical service to Dustin, I was accused by the FDA of using medication which is not approved by the FDA and been involved in interstate transport of the medication. FDA was asking the court for 270 years in prison and $50 million fine. So this was a criminal investigation.
With the court trying to stop Dr. Brzezinski, Jack and Marianne traveled to Houston to testify on his behalf.
We backed Dr. Brzezinski up 100%. The court hearings, we attended every single one of them.
The media picked up the story, asking, if you convict the doctor, are his patients being sentenced to death? The Canaries suddenly found themselves in the media spotlight.
We are outraged because this treatment is not toxic and it has helped many lives. It has saved my son's life.
I was continuing to treat patients, spending all the day in court and coming back in the evening, seeing patients till midnight, like they go into court again.
You don't take somebody off of a treatment that's working and doing well. I think that's just injustice.
Would he be able to continue with this treatment? What would happen to Dustin if he couldn't get the anti-neoplastins again?
Without this treatment, my son will die.
Jack and Marianne Canary's young son, Dustin, had a cancerous brain tumor that was threatening his life, until Dr. Brzezinski's unorthodox anti-neoplastin therapy gave the Canaries renewed hope. But Dr. Brzezinski was embroiled in a legal battle with the Food and Drug Administration, who wanted to shut his practice down. But finally, the tide began to turn in Dr. Brzezinski's favor.
Because of congressional investigation, FDA was forced to give us the status of additional clinical trials, and Dustin could continue the treatment, but I was still facing 2 years of court hearings.
Much to his family's relief, Dustin was able to continue with the anti-neoplastin treatment. His condition then plateaued.
And it did stay the same for a series of probably 2 MRIs. And the third one, there was no tumor. It was gone.
Dr. Brzezinski prevailed in his legal battles. He is now in phase 3 of FDA-approved clinical trials on his anti-neoplastin therapy. His methods are slowly gaining acceptance within the mainstream medical establishment. As for Dustin Canary, his journey of recovery was back on track once he resumed treatment.
He continued such treatment for additional about a year and a half, if I remember well. Then the treatment was completely discontinued, and he's now tumor-free for over 15 years.
I'm here. I shouldn't be here. Statistics are outrageous for kids with the tumor I had. I remember seeing younger children my age in wheelchairs, bald, not moving. And I don't know if I comprehended at the time that that could be me.
If Dustin would have went on the chemotherapy radiation regimen, I seriously don't think that Dustin would have lived past the age of 3.
Now that I'm older and I know the story a little more, my thoughts about Dr. Brzezinski are increasing. He knew exactly what he was doing in working on small children.
I was attacked by federal government, I was attacked by the state government, but I won all of this. So now I was cleared from all of these things.
Dustin's special in a lot of ways. You spend time with Dustin, he's got the biggest heart.
I am attending a Bible college right now, and I am planning on going to paramedic school after that, and firefighter training, and living close to home, and just serving the community as a firefighter paramedic.
What he learned through going through this cancer, that he can reach out to others, tell others his story, and just be a hope beyond hope for many, many people to come.
Lots of kids at school have no idea that I even had cancer, and when I tell them the story, they're fascinated. I just usually tell them to Google my name.
Dustin has been cancer-free and completely off the anti-neoplastins for more than 12 years now. Without ever receiving chemotherapy or radiation, he is cured of the cancer that once threatened his life. Dustin and his family are thankful to Dr. Brzezinski, a man whose pioneering research paved the way to a revolutionary new cancer treatment that continues to save lives. For more information on Dustin Canary and the Brzezinski Clinic, please visit our website. I'm Jewel. Join us next time for another remarkable story of personal triumph on the incurable.